My name is Barrett Stover. I'm the owner of RSP, and today we're talking about thoracic rotation. Obviously, with the majority of athletes that we work with being golf and baseball players, it's a problem that we see where we have limited thoracic rotation or poor thoracic rotation to one side, and we want to even people out a little bit. So what we're going to talk about today is what we look at through the evaluation process, what we do to solve that problem, and how it's different from how other people might approach it. One of the different ways we approach thoracic rotation is looking at whether we have compression issue in the back. A few of the tests that we do for thoracic rotation don't actually have to do with rotating the chest necessarily. We're going to be looking at the arm and the upper body. So the first one is a shoulder abduction test here. So I'm going to just drop the arm off the table parallel or 90 degrees with the arm here. So right here I hit the in range of motion. Anything past this I really have to push on pretty hard to get it down. You can see that the forearm and the elbow are about parallel with the table here, and we want about a 30-degree drop. If you want to contrast that to the other side, we take his right shoulder off and we can get it down where 25, 30 degrees off the table. I don't need to measure it. The more you do these things, obviously the easier it gets to tell where the in range is and if it's a pass or fail, but we are using more of a pass-fail scale here. So the right side, obviously pretty good. Left side, not where we want it to be, much stiffer at the in range of motion. So what's that telling us is that we're not looking at pec length there, we're looking at rotation. We're gonna have trouble with posterior compression there. We're probably already compressed in the backside, so we don't have the range of motion to drop that arm off the table. So think about it like we're already against the wall and we're trying to push even harder against the wall because we don't have the adequate space to move. Another test that we use is the external rotation of the shoulder, obviously with pitchers and golfers. And hold it there as we deliver it to the ball. We need to have good external rotation on your dominant side. So yes, it is very important for you to have ER for the sake of your shoulder being able to do what we need to do in baseball and throwing specifically or golf. But we're also looking at to see if there's a compression issue in the back of the shoulder as well. So if we go into external rotation where we have, again, the arm starting at 90 degrees at the elbow, and the shoulder here, and then we're parallel with the ground to start, and we come back here and we're a little bit stuck. We're getting maybe like 10 or 15 degrees of motion. It's also telling us that we're, again, compressed here and we don't have the availability of the space needed to move to get into more external rotation. If I crank them into scapular depression and really pull them, I might be able to get them there, but that's not what we're looking for. So we're gonna try to keep the scap in a neutral position here and just get as much range of motion out of the actual shoulder joint itself. So if we go to the other side for him, we'll see if it's the same or different. And we see it's maybe not great, but a little bit more. For someone that's not an overhead thrower, I wouldn't be too concerned about that. But again, I'm more looking at the differences and then adding up, are we getting stuck for external rotation and abduction? And if so, I'm making a mental note of that, along with writing it down on our eval sheet to come back and check when we go to the thoracic rotation. If all of those things add up on that side, then we're gonna look at hammering out some posterior expansion in the prehab and throughout the workout to expand that area first so that we can then better rotate through that side. The next test we're gonna do is a seated thoracic test. So this is your more traditional thoracic rotation test. We're gonna have his feet planted firmly on the ground. We're gonna have some type of apparatus between his knees to squeeze and keep him in a neutral position to make sure that his knees aren't kind of shearing back and forth. And then we're gonna cue that the feet, knees, and hips stay completely still. We're gonna sit up nice and tall, and we're only gonna rotate through the upper body. So from here, we're gonna cue just slowly to the right, go as far as you can until you feel like you get stuck or that right knee feels like it's shifting back. So that's good right there. And then we're gonna cue to go to the left, same thing. Don't let the left knee shift back, go as far as you can. Boom, he gets a little stuck a little earlier right there. So we're looking at maybe like a 10 to 15 degree difference between the right and the left. So now we have 3 tests to add up to say he doesn't externally rotate very well, he doesn't have good shoulder abduction, and he doesn't rotate the left very well either, or there's a discrepancy between the left and the right with all of those. We need to address that problem, which we're gonna identify actual lifting program to help expand that area in everything that we do. The general idea is that this left side is going to be compressed and retracted back this way. So obviously if you're already there and you try to go to move that way, you don't have as much room to move. And so the test is going to show up as being a worse fail, less than the right side, whatever you want to, however you want to phrase it. So to fix that issue, if we're stuck back this way all the way, then to fix it, we want to expand it by more or less reaching up and across that way. So we're opening this side up and expanding it that way. So as we go through these exercises, just be aware of that we're stuck here. To fix that, we're going to do the opposite. We're going to lengthen it out. We're going to get long and strong in the backside here to, again, fix that compression that's back here and add some expansion. So the first exercise we would take someone to after not doing well on those 3 tests on either side is the seated posterior expansion exercise right here, where we're going to work on some breathing. So we're going to cue to be in a seated position, elbows right about 90 degrees. We're going to have a 20% effort of pushing down into whatever, in this case, the box. So 20% effort pushing down there. We're going to cue sitting nice and tall with the head without the chin lifting up. Carlo's in a really good position there. And then push the upper back, lower neck away from the box. So we're, again, stretching all this area out. From that position, we're just gonna inhale, slow, deep breath in through the nose, and we're gonna inhale without shrugging. So if I put my hand here, I can feel that back expanding some, and then we're gonna exhale, and as we exhale, we're gonna cue through the mouth like you're blowing through a straw, and feel the rib cage drop back down and in. The key here, which Carlo's doing really well, is that he's not losing height as he exhales. He's keeping that good posture there. So inhale again, feel that back expanding, good, exhale. Blow it all out, feel the ribs drop back down and in even more without losing your posture. So we're gonna do somewhere between 2 to 4 sets of 4 breaths. So slow breath in through the nose. We should not hear you inhale at all, so we don't, where we're using the neck muscles to pull the air in, just a nice slow deep breath in through the nose and exhale through the mouth like you're blowing through a straw. We're gonna do that 4 times. We're gonna get about 2-second pause in between each breath. After you do 4, take a break, relax, shake it out, and then repeat for another 2 to 3 sets after that. So while it doesn't look like he's actually doing anything in this position, that's what we want. That means that he's doing it right. Again, we might see a little expansion on the backside as he inhale, exhales. That's fine. One way to double check is to see if you're doing it right is you may be sore the next day. I've done these before and been very sore the next day. Upper trap, upper back from feeling that stretch and actually the expansion. Think of it as like an eccentric training method. That's huge. Or you can retest external rotation and see, especially on the side that's limited, in his case, the left side, if we have external rotation that's improved after doing a few sets of 4 breaths on this side, then we know it's working. So now we're gonna get more specific to the side that we're having the issue on, in this case, again, the left side. So we're gonna have his right foot forward here, be a nice split stance position. Shoulders will be rotated a touch, and he's gonna feel like he's reaching down and across towards my hand with his left hand. And again, we're feeling a huge expansion on the left shoulder now, not really anything on the right. The right would actually be slightly retracted here, but we're feeling protraction, upper rotation this side, so the back's expanding, and as we inhale here, the cue is gonna be to feel like the area where your scap is filling up with air. So that part's gonna be inflating now. We're doing the 4 breaths, and we're loading up the front leg here, so we're feeling the ground, we're in a standing position, and we're just doing the left side. So we're gonna have the same cues for the breathing as we did with the seated posterior expansion. We're gonna breathe in through the nose, exhale through the mouth, nice and slow, not use our neck, all those good things. We're gonna focus now on expanding through the upper left back. So I think about where the scapula is stretched or protracted. That area is where we should be expanding or feel the air expanding now. We're gonna do that for 4 breaths, same thing with the breaks in between each breath. And then after 4 breaths, totally relax, come out of it, reset, do 2 or 3 more sets of that. Now the idea would be transitioning into the actual exercises or the meat of the lifts. We're going to implement it into some rowing variations and into some pressing variations. So this might be more of an auxiliary lift where it's not the main compound stimulus lift of the day, but we're gonna make sure that we have it in there consistently. So we're strengthening him in these lengthened positions, specifically to his left posterior side here. So you can see starting in that same position with a big stretch to the upper left back, up and across. He's gonna pull back and down. And yes, we are going into compression here, but think of this as more of like an eccentric. Not be arching and rounding our back as we do this. So go ahead, Carlo, back and down there. Good. And then we're reaching up and across as we go. basically no rotation again to get that extra stretch there. Go ahead, one more, all the way back and down. Love the speed that he's doing it right now. Again, this isn't gonna be the primary mover for the day, so we're gonna go a little bit lighter. We're not gonna ego lift this, and we're gonna focus on having really good position there, big reach, and good slow controlled movement. So for our pushing motion, we're gonna do something more like a landmine press. We have him set up in a split stance, so the same arm that he's using, that leg is back, and we're gonna be using the right arm too, so we are adding some rotation here, and we're gonna focus on a little bit more of a reach at the end with the left side. So he's gonna go into a push here, and then at the end, reach a little bit more, good, without shrugging, and then back down. So again, we want the rotation. That's a plus here. We're adding that in, keep going, and getting a little bit extra reach. So we're still getting a big stretch through here with the rotation, and then go back down into it. And then we're teaching ourselves to rotate back into that position as well. So again, are we strengthening ourselves out of that position into posterior expansion? Yes, but anything in sport, we're gonna have to be able to get into compression and expansion, so we're kind of adding that in here as well. So you contrast this compared to a traditional pressing exercise where you're laying on your back. You're gonna be stuck more in a compressed position here, and you're usually not gonna get out of it or add any rotation like Carlo has here. So we wanna be able to do the motion and rotate as we go with the extra reach in like a unilateral, and again, it's basically a walking position exercise, and add that press in as we go. So again, we're strengthening as we're doing the motion. We're not just doing some type of unweighted mobility drill, but we're training strength through the entire range of motion that we want to add to this person. So one of my pet peeves is when people talk about using an open book as a way to improve thoracic rotation. Do we use them? Yes, but we want to use them as more of like a movement warm-up, as opposed to something that we're doing as a mobility drill that's going to increase some type of range of motion. So when we're doing them, first of all, it doesn't increase range of motion because like we talked about, we've figured out through an evaluation that Carlo's compressed on the left side. So why would we take something where we're just hammering that compression and trying to rotate this way over and over again when we're just compressing more and more into the left upper back in this case. So for him, we wouldn't necessarily do these right off the bat. The second thing is, if we're doing them, we want to make sure that we're adding a reach as far as we can the other way. Now we're opening up the entire backside. And like I said before, anything we do in sports, we're going to have to pretty much get out of compression and into expansion and vice versa. So not bad that that's happening here, but we want to make sure we're getting the expansion and not just living in compression. So if we're reaching all the way over and then we're coming back and we're reaching that hand out that way as we do it, then we're having a much more effective exercise than just laying here, rotating and getting into some scapular retraction and a little bit of torso rotation as we do it. So the intention behind why we do this exercise and then who we prescribe it for and the way we coach it really dictates how effective it's going to be for that athlete. But if we're looking to expand somebody's thoracic rotation and they're already compressed posteriorly, we're not going to have them do open books. So a few major points to follow up on. One, we are not going to be so specific with the movements that we don't do the big compound movements with these people unless there's a huge underlying pain issue or a movement issue for someone that's very trained. If someone is 16 years old and they haven't even lifted for 6 months, we're not going to worry about this right away. There's a lot of other lower hanging fruit that should fix the issue. As we get stronger, we teach them better movement. But if someone comes in that's a little bit older and they're really stuck and it's really preventing them from doing what they need them to do, for instance, like a right-handed golfer and finishing their golf swing, and there's someone that's a Korn Ferry PGA golfer, then it is something we'll address right away. The other thing is we want to make sure that we use multiple tests to get the answer to what's going on. So that's why we have those 3 things that kind of check each other, a checks and balance system to say what's the issue and can we address it. And then also when we go back and test at 4 to 8 weeks later and do a retest, we'll see if what we did actually worked and if we can improve that rotation to the left along with the abduction drop test and the external rotation. So we're then double checking our work to make sure that what we did wasn't just eyewash, wasn't something to make the guy feel better about himself, but something that actually helped the athlete improve. And lastly, we don't want to just pound a square peg into a round hole and force rotation left over and over and over again if we're already compressed or possibly our torso is rotated that way and that's why it's compressed on that side. So we want to take the approach of let's get them moving better, let's get the expansion first. as we get that expansion, as we're moving better that way, then we can start adding in that left rotation if it doesn't clean up. Lastly, we want to make sure that we're not pounding a square peg into a round hole by just forcing left rotation for someone that doesn't already rotate well to the left. Again, that could be because their torso is already rotated that way, or because of the posterior compression, or some combination of both. So if I'm doing that and I'm just rotating left constantly, it's going to increase the problem, not help the athlete. So let's worry about the posterior compression first, fix that issue through the expansion of that left posterior side in Carlos' case. And then after we start fixing that, we can worry about, are we rotating to both sides like we want, and how do we make the next step in increasing the thoracic rotation from there.